Hi, good afternoon. My name is Dr. Bob Dannenhoffer. I am the public health officer for Douglas County. I've also been a pediatrician in town for about 30 years. So I've seen a lot of respiratory illness over the time. And as primary care doctors, this time of the year is also always a little bit of a wary time because we know that over the next few months, we're going to see a lot of people with different respiratory illnesses. I have some slides, but we're going to have plenty of time for questions. So if you have those questions, please put them in the chat. So there are hundreds of different respiratory viruses that circulate every year. We have rhinoviruses, adenoviruses, coronaviruses that circulate each year, cause upper respiratory infections with runny nose, cough, sore throat. Most spread in the winter because the air is drier, because we tend to have closer contact, because schools were open, and because other people have it, it just leads to the contagion. In the spring and summer, these decrease as the air, as we spend more time outside, and as these things naturally go away. Most of these respiratory viruses cause infections that are mild and self-limited. It might take a day or two off, but they tend to be mild and self-limited. Most times you don't even need to see the doctor, and very rarely do they lead to anything serious. However, in kids especially, they can sometimes lead to ear infections and sinus infections. So not uncommon in kids for them to have a cold and a few days later to get an ear infection, or adults to have a cold and a few days later to get a sinus infection. So there are hundreds of respiratory viruses. Most times we don't know which one it is that causes your cold, but there are three of these hundreds of viruses of note because they can be more severe, they can lead to hospitalization, and they could turn out to be leading causes of death among seniors. And as I get to be a senior, this is all that more important to me. So in general, respiratory viruses spread by droplets. Some are airborne. But there's some general things you can do to prevent the spread of disease. First is to stay home if you're sick. Obviously, when you're sick, you may be sharing germs, and you tend to share germs most in the first few days of the illness. It's important to cover your cough. Again, when we cough, we spread out thousands of droplets that contain infectious particles and can infect others. It's important to wash your hands. One of the typical ways that this is spread is you have the germs on your hand from stuff that's in the air and then touch your face and your mouth, and you can go ahead and spread that. And wearing a mask does help. There's no question about it that wearing a well-fitted mask to decrease the risk of you spreading it to others, and if you're in a place where others are sick, like a doctor's office, it can prevent you from getting sick. I have except for 3 times when I've had the flu, you don't usually get sick from the patients because we're careful about washing our hands and wearing a mask when kids have respiratory illnesses. So the first one we're going to talk about today is RSV, or one called respiratory syncytial virus. This is a virus that causes a disease called bronchiolitis in babies and pneumonia in adults. This is a drug that's been around for many, many years. It spreads almost every year, typically starts in the United States in the late fall in the South around New Orleans, and then spreads, and typically Oregon gets it in January, February, March of each year. In babies, it causes a terrible wheezy cough, shortness of breath, and frequently leads to hospitalizations. So we know that in the wintertime, we're going to see dozens of babies with bronchiolitis. And it is interesting that the earlier you are in life, the worse you get it. So a preemie who comes home from the hospital really at risk, 1, 2, 3-month-olds really at risk for getting quite sick. But by the time the babies are 2 and 3 years old, they get just kind of a cold. And what happens then is the older kids get it at daycare or something else and then bring it home for the babies, and then the babies get quite sick. And if you've ever had a baby with bronchiolitis, it's really heartbreaking. In seniors, it leads to this deep cough, pneumonia, and sometimes leads to hospitalization and death. In kids, 60,000 hospitalizations a year and 1 to 300 deaths. And in adults, 60,000 hospitalizations and 10,000 deaths in seniors. So it really is a fairly common cause of severe disease in adults. And the bad news with RSV is once you get it, there is not really good treatment. We treat supportively with oxygen and fluids, but just heartbreaking to watch these babies who you know are going to be sick for a week or two when they get this bronchiolitis. And until recently, there was nothing you could do to prevent it. So it was a disease for which there was no prevention and no treatment, which spread every year. And this was the number one enemy of pediatricians. But there's good news. So the good news is over the last few years, there's a very accurate, fast, and cheap way to test for RSV using a nasal swab. It's one of the swabs just in the front of the nose. It takes about 10 minutes to get a result. It's very accurate. And so if it's positive, you've got it. If it's negative, you likely don't. Um, and for infants, there are now some really effective preventive treatments that can reduce severe severe disease by 90% in infants. So rarely do we see something that's that good. But indeed, this is what we've had. And for older adults now, we also have a very effective vaccine that decreases the risk of hospitalization for adults by maybe 60 to 90%. The adult vaccine is recommended for those who are over the age of 70 or those who are 50 plus with lung issues. It can be given to younger people who have lung issues. So if you think you have some underlying stuff, you should talk with your doc. For babies, you can give the vaccine to moms while they're pregnant in the last trimester, and then she would develop antibodies that come across the placenta and protect the baby. And again, very important. And if mom does not get the vaccine, we now have a monoclonal antibody. That's an antibody that's made in the lab that we can give to babies soon after birth that gives 6 months of protection. And remember, the first 6 months is the time that the kids are the most sick, so they really get quite a bit of protection. And over the last 2 years, it's really decreased hospitalizations by 80 or 90% using this strategy. There's more good news. The good news is that while lots of vaccines have been controversial, this vaccine and the monoclonal antibody are not controversial. And in this area, CDC, which is the federal agency that works with vaccines, ACIP, which is the Advisory Council on Immunization Practices, the Academy of Pediatrics, and ACOG all agree this is a good thing. So for seniors greater than 70 or greater than 50 with underlying lung issues, for pregnant moms, and then monoclonal antibody for babies, everybody agrees that this is a good thing and we should do it. The insurance companies cover it. And my advice is, I agree. I would love to see the last case of RSV ever. Probably not going to happen in my lifetime, but certainly I don't want to see any more babies hospitalized or dying from RSV. And the good news now is that we have the way to go ahead and do that. So RSV, there's really good news. I'd encourage people who are in the age groups to go ahead and get it, and for pregnant moms to go ahead and get the RSV vaccine. And if you don't, for your baby, then to get the monoclonal antibody. So influenza, another one that's going to come around every year. So this virus has been around for a very long time. For as long as people have recorded illnesses, there's been flu-like illnesses along the way. And influenza is a fascinating virus. There are different influenza types that affect all sorts of different animals, birds, almost all land mammals, whales, seals. Not exactly clear how whales, what a whale cough would sound like, but they do spread it among whales, and seals can get influenza. And it's interesting that most influenza types only affect one species. But sometimes a flu type can affect people plus other species. And that's why in the past we've had times when we've had a bird flu that affects both humans and birds, or swine flu that affects both swine and pigs and people. We think, for example, the great flu epidemic in 1918 started in swine and then moved to people. And these flu viruses change from animal to animal and year to year. So they change pretty quickly. And so when you have a flu vaccine from one year, it may not work in the next year because things have changed. So one of the questions come up, well, how do you predict what kind of flu virus we're going to have? Well, typically this is a winter thing. So it spreads in the northern hemisphere in our winter, spreads in the southern hemisphere in their winter, which is our summer, And so that goes back and forth from the northern hemisphere to the southern hemisphere and back to the northern hemisphere. And so typically what we look for is we look for what virus is circulating in South Africa, Australia, New Zealand in our summertime, and then make a vaccine against that. And it is pretty good, but not perfect. And that's why the influenza vaccine is sometimes a good match for the virus that's out there, sometimes not a good match. So flu vaccine is made to prevent the kind of flu that is seen in some hemisphere this in the summer before. So we're just ending the summer and the summer in the southern hemisphere. They've had sort of an average flu season. We know what viruses have circulated, and that's what the vaccine that is now out works against. Sometimes it's a good match, sometimes not so. Sometimes what happens is there's a new virus that wasn't circulating in the southern hemisphere that now begins to spread. Those of you may remember back in 2009 or so, we had a swine flu that started actually in Mexico that was not well covered by the vaccine because it hadn't been circulating in the southern hemisphere the 6 months before. So there are two major types of human flu. There's influenza A, which tends to be more serious, and then influenza B. So in the past, flu has caused very severe disease. So in 1918, there was a Spanish flu, probably misnamed. It probably started actually in the US, that circulated in 1918, and they think caused 50 million deaths worldwide. It is one of the biggest pandemics that we'd had. At that time, it spread very quickly. It was during World War I, so people were traveling by train and troop ships, and they spread it around the world. The good news on influenza, there's a simple, accurate test from a nose swab. And unfortunately, with influenza, we have really confused people by saying, well, I have the stomach flu, or I have flu-like symptoms, or people come say, had the flu 5 times last year. That's all wrong. So true influenza is really not all that common. So when we have a winter, even a bad winter, maybe only a few percent of the people actually have true influenza. So true influenza is not all that common, but when it occurs, it's absolutely memorable. So I've been in medicine now for 50 years. Yikes. And I've only been sick a few times this whole time, and 3 times it was with influenza. Each of those years was a year there was not a particularly good match for it, and I can remember vividly the 3 times I had the flu, um, very rapid onset of symptoms. So, as kids say, I felt fine in 3rd period, but by 5th period, it felt like I was gonna die. I mean, really at rapid onset of symptoms, fever, headache, and incredible malaise. So anybody with true flu is not wanting to get off the couch. Um the problem, unfortunately, is a lot of flu spreads in the time before you actually have symptoms, and that's how it spreads around. But really, lots of fever, 104, 105 degrees, headache, malaise, and really rapid onset of symptoms. The severe symptoms last a few days and then slowly resolve. To people who have the true flu are typically not back to 100% for a week or two, and for athletes, they're not back to peak athletic performance for months. So for people who are in pro sports, they really worry about influenza because it could be half a season that you'd be not back to performance. Flu is bad because you sometimes have secondary pneumonia and ear infections. And the two groups that really struggle with flu are seniors and babies. So 30-year-old who gets the flu, nasty, you're home for 3 or 4 days, you say, "Oh god, that was terrible." But you don't usually wind up getting admitted to the hospital, but seniors and babies who are weakened really struggle, and they're the ones that need to get admitted to the hospital because they're so laid out from the fever and the headache and the malaise that they're not eating, they're not drinking, they get dehydrated, sometimes they get a secondary pneumonia or an ear infection, and these are the people who get admitted to hospital and even die. So we think there are about 50,000 deaths a year from influenza, most in seniors. They're usually in kids between 100 and 300 deaths from influenza, but it's really seniors who get this, and that's why it's important that seniors get the vaccine. There's good news on influenza. There's good oral treatment for influenza. So there's a couple different brand names. Tamiflu is the one that people know the most. It's recommended for seniors, those with underlying conditions, and babies. But if you're going to take it, you really need to get in the early stage of the disease in the first or second day. If you waited till you're sick for a week, it really doesn't work that well. But best is prevention with a flu shot. The good news on the flu shot, it gives some protection. It's not 100%, but generally about 60% protection. The backwards thing is it works best in young people who typically handle the flu better than seniors, and it works less well in the seniors who get sicker from it. And so when people talk about getting a flu vaccine, a young person getting a flu vaccine. Well, why should I get a flu vaccine? I'm 25 years old. Even though I get the flu, it's not going to be so bad. The reason you get it is to protect grandma, because flu typically comes into the community from traveling adults. And so usually comes into community from adults who travel for work or clearly around the holidays. So Thanksgiving, where everybody gathers for Thanksgiving, or Christmas, where everybody gathers. We see big spikes in flu in the week and two after um, Thanksgiving and Christmas. So typically it comes into the community from traveling adults, spreads to kids, and then goes back to the grandparents. So typically when you ask how grandma got the flu, um, one of the grandkids had it, or somebody around had it, or a caregiver had it, and they gave it back to the grandparents. So we suggest a flu shot for everybody over 6 months to protect both babies and to protect grandma, even if it's not going to give the 20 or 30-year-old particularly lots of protection. The good news on influenza is that everybody agrees that everybody 6 months and above should get a flu shot. Now, Bobby Kennedy personally has said he would never in a million years get a flu shot, but all of the agencies that he's over agree that everyone 6 months and above should get a flu shot. There is a special flu shot for seniors called a high-dose vaccine, and you should talk to the doctor or pharmacist about that. The best flu vaccine is the one that's in your arm, but for seniors, you may get a little bit of additional protection using the high-dose vaccine. And I'd also recommend that if you get the flu or are at high risk, you should talk to your doctor about getting Tamiflu. It's not magic, but it really does help to prevent some of the more severe complications and can decrease the risk for hospitalization. For young, healthy people get the flu, it's kind of a 50-50 thing, but certainly if you're a senior or a baby at high risk, you should talk to your doctor about getting Tamiflu. And then the last is COVID. COVID is the one where there's always lots of controversies, and this is a kind of coronavirus, and there are lots of different kinds of coronaviruses. First noted in China in late 2019, not 2109. Um, and what we recognize is that the first time people got COVID, or the first time they were exposed to it, it caused severe disease in seniors, leading to many hospitalizations and deaths. Young people tended to handle it better. And actually, this is a weird disease. Their babies didn't seem to be that badly affected, but still a lot of hospitalizations and deaths, even among younger people. So even last year was a pretty quiet year for COVID, but still there were 40,000 deaths. And even in Douglas County, we had dozens of hospitalizations. And the issue with coronavirus is that in kids, it causes some weird, weird, weird things. There's this thing called MISC-C, which is something that comes 6 or so weeks after a COVID infection. Kids typically had a COVID infection, barely knew they were sick, but 6 weeks later, they're deathly ill with high fevers, lots of inflammation throughout the body that we think is actually from coronavirus. The other thing that I saw a lot in kids was chest pain. So kids who had COVID, not particularly sick while they had COVID, but a few weeks later, just this terrible strangling chest pain, which kids don't usually get a lot of, this sense of chest tightness and real difficulty exercising. So I must have seen 100 kids with that kind of thing, and they were worried that they had a heart attack because it sounded about like a heart attack. And many of them missed a year of sports because of this chest pain that they got from that. And then long COVID, where people have symptoms of sometimes loss of taste, sometimes brain fog, sometimes severe fatigue that lasted for weeks or months or even years. And this happened at all ages. So I can tell you among kids, we had kids who said, well, they had COVID last month. They didn't seem to be very sick. And now they're sleeping 20 hours a day, like you might from mono, or just can't do well in school because they've got such brain fog. And again, the good news is that for most kids, they get over the long COVID. Some adults have been slow to get over COVID, but so COVID just a nasty thing. Um, the story is that over the years, most of us have had one or more bouts of COVID. Some people have had as many as 4 or 5 bouts of COVID. And many of us have gotten one or more doses of COVID vaccine. And it seems the more you've been exposed to COVID, the less serious the disease is. So it's less severe for those with previous experience. Still had 47,000 deaths in 2024. Um, but the more you've been exposed to it, the milder it seems to be. Um, we're still seeing some hospitalization deaths, especially among the elderly, and especially those who have just never experienced the virus, right? So there are some seniors who don't have a lot of outside contact, haven't been around a lot of other people, and have never had COVID. When they get COVID for the first time, they still get quite sick, and that's where we're seeing the hospitalizations and deaths. The COVID virus itself is very prone to mutation. And since it's very prone to mutation, it changes. So you remember about Delta and Omicron and whatever. We're seeing one called Sierra now, which causes some bad symptoms. People say it's like 1,000 razor blades in the throat. It sounds terrible. And so there's each year a new vaccine to deal with the circulating strains. The good news on COVID is there's an easy, widely available test for COVID. You can get it both over the counter and pretty much every doctor's office has it. The good news is there's an effective antiviral drug that should be considered for those at high risk, like especially those people who are over 65. So Paxlovid, an antiviral drug, it's not perfect, but it does seem to reduce the risk of hospitalization and death. The COVID vaccine is incredibly controversial and incredibly political. Who ever thought that vaccines would be leading the list of political discourse? But the good news is that the new recommendations mostly agree. So had I done this a week ago, I would have said nobody knows what everybody's going to decide. But at this point, I think pretty much everybody agrees. So ACIP, which is the Advisory Council on Immunization Practices, met last week, and they recommend that all people 6 months and above talk to their provider, which is great. The Academy of Pediatrics recommends those between 6 and 24 months get one because they do tend to get a bit sicker with this. And those 2 to 18 talk to their providers, so pretty much overlapping. ACOG, who's the American College of Obstetrics and Gynecology, recommends that pregnant women get it because pregnant women do seem to have more issues with COVID while they are pregnant. We certainly knew during the height of COVID that pregnant women did seem to suffer more with COVID. And pregnant women are not, there's a lot of things change while you're pregnant, but your immune system is somewhat weakened during pregnancy so that you can carry this baby inside you. And because of that, they also seem to be more prone to certain illnesses, including COVID. So ACOG recommends that pregnant women get it. AAP recommends that babies get it. Older people should talk to their doctor. And ACIP recommends talk to your doctor. Okay, so pretty much an agreement there. And so those are the questions. So last week, we weren't sure about insurance coverage. There is going to be insurance coverage for each of these vaccines. Last week, we weren't sure if you needed a prescription to get one. It's clear you do not need a prescription to get these vaccines. In Oregon, if you're 7 and above, you can go to the pharmacy and the pharmacist will get it for you. And at any age, you can go to your doctor and they can help you with getting it. So that was it. I say plenty of time for questions, and I see that we have some.
Yes, thanks, Dr. Bob. That was great. So we've been tracking questions, and we have some categories. We have a lot of questions on vaccines, some questions on testing, and some questions on prevention. So I'm going to kind of go through the list as we go through. all these and ask you those, and then have you try to respond. So, one of the first questions is about the RSV vaccine. Is that a one and done vaccine?
At this point, it is a one and done vaccine. So for seniors, one and done. For pregnant women, one and done. So yes, it's a one and done vaccine.
Great. I'll jump to testing. There's a question: are there free rapid COVID and or flu testing kits for healthcare workers? Without free COVID tests, it's a challenge to return to work.
Yeah, there are not free COVID tests anymore. Now, there you can buy them. They tend to be about $7 to $12 a piece that are very accurate. In the past, there was a requirement that you test before you return to work. There is no longer a requirement for testing before you return to work. We say now that if you're afebrile for 24 hours and your symptoms are improving, that you can return to work. People in high risk occupations, such as medical offices or nursing homes, should wear a mask for an additional 5 days. But that need to retest to return to work is no longer there. And if anybody's saying it is, give me a call and we'll inform them of the current.
Great. We'll ask a question around prevention. One person said, since having COVID a couple of years ago, my lungs have never been the same. Every time I've had to get had a cold since then, it turns into bronchitis or pneumonia. Are there any things that can be done if sick to prevent it from developing into something worse?
Yeah. So we have known that the number of people who had COVID, even not that severe, have some long-lasting lung damage. And so you should talk with your doctor about that. In many cases, those people can prevent them from getting bronchitis by using an inhaler that has cortisone in it, a cortisone type inhaler like budesonide or fluticasone. And using that when you get a cold can sometimes help prevent this from going to bronchitis. But that's a great question to ask your doc because we certainly have seen a lot of that. People who never had lung symptoms before got COVID, and then since then, every time they get a cold, they get quite sick. But the inhaled corticosteroids really can help.
Excellent. I'll ask a question again about vaccines. One of the questions is, when do public health officials usually get a sense of how effective the flu vaccine for that year will be?
So again, remember the flu vaccine for our our winter 25-26 came from the flu that was circulating in South Africa, Australia, and New Zealand in 24-25. We typically find out anecdotally fairly early, right, within the first month or two, when you start to see immunized people get the disease. And the highest group of immunized people are healthcare providers. And so when you see a lot of disease among healthcare providers, you know the vaccine is less important. They typically wait until a little later in the year because sometimes the virus changes a little bit to talk about vaccine efficacy. Sometimes it's as low as 30 or 40%. Sometimes it's 60 or 70%. It's never 100%. But the more people were vaccinated, the less likely the virus is to circulate. And the less likely it is to circulate, the less likely it is to mutate.
Excellent description. Another question. This is specific to the differences between what are the key differences in how flu, RSV, and COVID are transmitted from person to person. And I know you've addressed some of the how to prevent the spreading, but are there differences in how flu, RSV, and COVID are transmitted from person to person?
uh, is generally the same. So each of these spreads mostly by respiratory droplets, sneezing, coughing, and such. And so they each spread in that way, but there are certain differences. One is COVID spreads in really tiny droplets, so tiny that we consider them to be airborne. So if you remember back in the days when COVID was really circulating, people would get it even from people who were well across the room. So there's a famous story of a choir practice where one person had early symptoms of COVID and spread it to the entire room. So we think there was probably some airborne spread of COVID. And so COVID is probably the most contagious and the most easily spread. Influenza's in the middle. And then RSV spreads not only by respiratory droplets, but spreads a lot by contact. And so for RSV, again, it's usually the 3 to 5-year-olds who have it, not that sick, but tons of boogers. And so as you're cleaning the boogers, as they're spreading boogers all over the place, it spreads. The other issue with RSV is that people who are infected tend to carry it for a while. Unlike COVID, you're not carrying very much of it after a week. Influenza, you're not carrying it much after 3 or 4 days, but RSV you can carry for 3 or 4 weeks. So you can imagine in a daycare where kids are slobbering all over the place, that it can really continue to spread around. So the differences are the general advice is the same: stay home when you're sick, wash your hands, especially with RSV, and to wear a mask. For COVID, you want to use the best mask you can get. In the past, we've tried to get people to wear N95 masks, especially in the early days of the illness. The problem with COVID and RSV is that they tend to be COVID and influenza is that they tend to be most contagious before you have symptoms. So with COVID, you're most contagious about 18 hours before the symptoms start. With influenza, we say you're contagious in the day or so before the symptoms start. So remember, I talked about the kids that I was fine in third period, but by fifth period, I felt terrible. Well, during first, second, and third period, they spread it to everybody, and so they were really contagious at that point before they even knew they were sick. And so that's why we're never going to get 100% control of the spread of COVID and influenza.
This is a question that's similar lines. Is there substantial evidence that air purification units in public school classrooms will reduce respiratory disease rates?
So there is good evidence from COVID that COVID spread was decreased with the use of improved ventilation. And improved ventilation means that you have more air changes per hour and that the air is filtered through a high level filter, such as a MERV 13 or above. So we know that if you do the kind of air purification that you can do in an OR, or the air purification that you can do with a properly sized air purifier with MERV filters, yes, you can do that. It's a little less, and that's because COVID was mostly spread in the air. For other diseases such as RSV, rhinovirus, and adenovirus, those are spread by hand-to-hand contact, um, sneezing in somebody's face. There's less evidence that you can prevent those with air purification. But in general, air purification is a good thing.
Great. Also similar along those lines. How long do the viruses for these three different diseases live on hands and items and things?
So RSV lives a long time. And so RSV is the kind of thing that is really hard to get rid of. So when we see a kid in the office with RSV, we really have to scrub down the room, and we tend not to use it again that day if we don't need to. Influenza is a relatively wimpy virus. Typically, after a few hours and with some cleaning, it's better. And similarly, COVID is very susceptible to cleaning agents and time. So it's sort of backwards in it's different between the three of them, but they do last for several hours. But uh, COVID and influenza are well cleaned, both with hand sanitizer and with things that you would normally use to clean surfaces.
I'm going to switch back up to some questions about vaccines. One person says, "We're not seeing a great uptake of maternal vaccination. What tips do you have for encouraging maternal vaccines?"
Yeah. Again, during the time people are pregnant, they're very reluctant to do anything, take any medicines or take any vaccines. But boy, we have really good evidence that it helps to prevent RSV in their babies, and especially in their really vulnerable babies in the first few months. You only really need to talk to a parent who has dealt with a baby with bronchiolitis to recognize how heartbreaking this is, because these are the smallest, weakest babies, and they are so sick and there's so little you can do for them. So just an understanding that this is a very safe vaccine, and understanding it's a very effective vaccine, and that we've really carefully looked at it and have not seen any bad side effects. Unfortunately, some of the comments made at a press conference earlier this week are going to make people worry about anything they do during pregnancy that might cause bad effects on the babies. Uh, as a pediatrician, having taken care of thousands of babies over the years, parents are already feeling guilty enough. Let's not make parents feel more guilty when we don't really know what causes these things.
Great. Thank you, Dr. Bob. Some people report feeling unwell after receiving both the COVID-19 and the flu vaccines, like things like fatigue, fever, muscle aches. Can you speak to why these reactions happen in the body and whether they're expected and how individuals can manage or prepare for them?
Right. So after you get a vaccine, almost any vaccine, your body makes an immune response, and that immune response is very complex, but all kinds of different cells that go ahead and make the antibodies. And you can have some fever, you can have some soreness where you get the vaccine, you can have some fatigue and malaise. The biggest was after the second dose of COVID vaccine. And I remember after the second dose of COVID vaccine, I actually took a nap, which is so unusual for me. But I actually took a nap for a few hours and then felt fine afterwards. But again, the symptoms you get from the vaccine are much less than the symptoms you get from the flu. So one of the things I say is every time I get the flu vaccine, I get the flu. So, well, tell me about that. Tell me about what's oh, my arm ached and, I felt a little drowsy and I didn't exercise that day. How'd you feel the next day? I felt fine. And then went back to work. That is not the flu. So the flu is, nobody's going to go to the gym the second day of flu. So it is a mild reaction in comparison to the flu itself, but as a reaction, is to be expected. It's perfectly normal, perfectly to treat those symptoms with some antipyretics or pain meds and then go on. And really when parents say, "Oh, they had this reaction," the answer is, "Well, the vaccine then worked, because that was your body making the response, which is the vaccine response."
Great. Another question. What age for the high dose vaccine that you mentioned? What's the age for requirement for that?
So we're recommending it for people 65 and above, because as we get older, we don't respond as well to the vaccine. We don't make as many antibodies. So the high dose vaccine is in many cases just 4 times the dose, and your body makes a better response to that. So we typically recommend it for 65 and above. There are some recommendations off-label for people younger than that who have underlying illness. We are not recommending it for kids because kids have a very brisk response anyway, and with 4 times the dose of vaccine, they have much more response than you would ever need.
Great. We have a couple of questions about timing of both the flu vaccine, RSV, and COVID. So, what are your best times or months to get those?
So COVID vaccine, I would get anytime since COVID does tend to circulate throughout the year, right? So we're gonna have some now. So I would get COVID vaccine in the fall. So September is a good time to get that. For flu vaccine, you want to get sometime between September and December. If you do it too early, the vaccine response can fade. If you give it after the virus is circulating, you won't have protection in time. So ideal times are going to be September, October, November, and early December. So that would be it. For RSV, RSV is very much for when it's circulating. So um, for the women who are getting the RSV vaccine, we're recommending they get it in the third trimester, between 32 and 36 weeks. And for the babies who get this monoclonal antibody, we're recommending it for um, babies who are up to 8 months when the RSV season starts. And again, it's different each year. Oregon typically starting in January or February, sometimes as early as December. But we let people know. And the way we know how it starts is a fascinating thing that happened. During COVID, we recognized that if you sampled wastewater, so the water that comes in the sewer system and goes into the treatment plant, if you sample that, you could tell how much COVID was circulating in the community. When there was a lot of COVID circulating in the community, there was a lot of COVID in the wastewater. When there was not very much COVID in the community, there was not much COVID in the wastewater. And so it's hard to believe that that works, but it really does. And so now we sample not only for COVID, but we also sample for RSV and influenza. And every week I get the report of how much stuff is circulating from the Douglas County wastewater, and so we can tell how much is going. Right now, there's not very much influenza. There's not much RSV. There's a moderate amount of COVID, which would go along with what we're seeing in the clinic. We're seeing some kids with COVID. We're not seeing any influenza or RSV yet. When RSV hits a community or influenza hits a community, those amounts of genetic material in the water really skyrockets.
Yeah, I'm glad you brought that up, for surveillance. That's something that is relatively new for us, is to do that surveillance through water. We've got some great programs at DPHM that have been working on that. So, a couple more questions about prevention. So, I have children who attend school. How can I prevent illnesses with them consistently bringing home germs and passing them around?
Uh, yeah, people call them childcare centers. We call them germ transfer centers, and they're really good at doing that. So the younger kids and kindergartners, especially, not particularly good at controlling their secretions, not necessarily very good about covering their cough, and then they do spread things around in the community. Um, when you're first exposed to these things, you're going to get them. So I wish I had a great answer. I really don't. um, Certainly my kids, when they went to school, brought things home and gave them to their brothers and sisters. Staying home when they're sick, some parents continue to send kids to school when they're sick. That's a problem. And washing hands, covering cough, those normal things. But you can imagine how hard that is in kindergartners.
Absolutely. Speaking of athletes, particularly student athletes and peak performance, should they be limiting activity in the convalescent stage of illness, or is it safe to continue training as soon as the acute illness is over for them?
It's safe for them to return to training as soon as the acute illness is over, although they may notice a real decline in performance. So track runners who know what their mile time is, um, will sometimes see that they're slower by a minute or so in the convalescent stage of influenza. It takes them maybe a month or so to get back to their best time. But there's not really a limitation on activity if they're otherwise feeling okay.
We also had a question on what are the symptoms of the current COVID strain that we're seeing circulating?
So the current COVID strain is causing a terrible sore throat. As we were saying, it's like the thousand razor blades is what the comment has been. So really a wicked sore throat without a lot of other symptoms. um, some fever, some cough. We're not seeing very many hospitalizations from it. So it really is, it sort of morphs around. And now we're at a time where it's causing mostly a sore throat. Interestingly, early on, COVID did not cause much of a sore throat, but as it's mutated along the way, it's causing more sore throat and less respiratory illness.
Another question about vaccines. Can they still be given to someone who has a cold or who's on antibiotics?
So again, you want to talk to your provider about that, but generally, if you have a mild illness with a cold or an antibiotics for something else, that is not a contraindication to getting most vaccines.
This one is close to my own heart since I just was on an airplane. How risky is it to travel on an airplane? Is it better to run the vent above you or to protect yourself, or other suggestions for being on a plane?
So airplanes are very interesting because airplanes were a great study case during COVID. So during COVID, we recognized that the airplane was one of the safest places you can be because airplanes have tremendously efficient air circulation. And so when they talk about air changes, planes typically have about 15 air changes per hour. And with 15 air changes per hour, you get a lot of circulation, and the risk of getting on the plane was a lot. However, the airports themselves, the cab that you took to get there, the van that you took to get to the bus, or the rental counter, they do not have good. And so what happened is travel was dangerous, but it was really not the airplane. It was the stuff before and after the airplane, which seemed to be risky.
Okay, we also have a question related to the corticosteroid inhaler for those who have had COVID before and are getting sick. Is it only the inhaler that will work, or does nasal spray work also? What's your recommendation on that?
Well, again, you should talk to your doctor about what your symptoms are. But if the symptoms are coughing and wheezing, even with a mild or upper respiratory infection, typically we use the inhaled corticosteroids.
Great. Looks like we have another one on the RSV vaccine. So, RSV vaccine for adults and monoclonal treatment for infants. What about the RSV vaccine for infants? And what are your thoughts about vaccinating them and for the booster that is recommended for the second season on high risk children?
So, so the RSV vaccine is not approved yet for babies, and you would typically have to wait a few months to give it, right? So we typically babies typically don't develop a good immune response until a few months of age. And remember, the highest risk for babies is in the first few months. So when I think of the babies that I take care of that have really severe RSV, they're almost always babies in the first 2 months. And if you gave them the vaccine, it wouldn't really protect them. Whereas the monoclonal antibody gives you immediate protection. So typically we're given that when the babies are about 10 days old, and so that they have protection starting from 10 days going out to about 6 months. Someday we may come up with an RSV vaccine for babies, but it wouldn't help as much as the monoclonal antibody or the maternal vaccination. So the maternal vaccination really works well because not only does it protect the baby from getting it because of antibodies that cross the placenta, but it also protects the mom from getting it. So a lot of times what happens is you have a mom and she's got a 3-year-old and a 5-year-old and she's having a new baby. The 3 or 5-year-old pick it up from school, give it to mom and the baby, and now the mom has got a cold and she's a little sick, but her baby is really sick. And we and that the maternal vaccination works because it not only protects mom, but also protects the baby and is really very effective. If moms don't get that vaccine, then we are recommending the monoclonal antibody for the baby.
Thank you. This one's just a curious question. Wondering if we humans in the Western world, anyway, are generally evolving to be more or less affected by viral illnesses. I'm recalling my grade school years in the 60s and 70s, and it seems we were all sick with colds and flu a lot.
Yeah, I think those things change. So the hundreds of other viruses other than RSV, influenza, and COVID have been circulating since the beginning of mankind, and they continue to circulate and people get sick. I don't think kids are any sicker or less sick than they used to be with upper respiratory infections. I remember when I was a kid back in the last millennium, there was still a lot of kids sick with colds and stuff like that. What we do see now is COVID, which is a new virus, which obviously did not exist back in the before 2019.
Then we had a couple of questions, just general prevention around if you have any suggestions on nutrition for prevention and management of acute respiratory illness.
So keeping a strong immune system is great. How do you keep a strong immune system? There's no one magic thing to do. There's no like one supplement you can take that'll make you better. But having a exercise, outdoor activity, well-balanced diet, all of those things can help. And avoiding things that can hurt your immune system. So we're worried about smokers. Smokers decrease their ciliary function, which helps you to clear viruses. Smoking anything, whether it be marijuana or tobacco or whatever. So we want people to avoid that. And then doing the washing the hands, covering cough or whatever. But otherwise, just trying to stay healthy by eating well, sleeping well, and exercise.
I think we're wrapping up, but we've got one question about testing. So, can you determine or talk a little bit about the testing again for each of the RSV, flu, and COVID, and whether or not you can determine which of those you have through a nasal swab?
Yes. So one nasal swab, and it's just in the front of the nose, doesn't go back to the back of the brain like it used to. So one nasal swab from the front of the nose can help tell the difference between RSV, influenza, and COVID. And they typically have quite different symptoms. So you don't have to necessarily test for all three, but the tests that are out there are very good. They can tell you what those are, typically results back within 30 minutes, and you can tell which it is. Now, not everybody needs to get tested, right? So if you're a otherwise healthy 30-year-old and you have what you think is influenza, you don't necessarily need to go in for test. But if you're a healthcare worker, might be exposing others. If you're taking care of a elderly parent or grandparent, those are the times that you may want to go ahead and get tested. And the tests are all available. They're all relatively inexpensive and pretty quick. So remember, in the first days of COVID, the first tests were PCR tests that needed to be sent away to a specialized lab. They cost several $100s and took a week to get back. We're way past that. We now have good, relatively inexpensive, and rapid tests.
Great. I think you touched on this, but we've still got another couple questions about it. Are you still recommending, or are we still recommending healthcare workers be off for at least 5 days from symptom onset if fever free for at least 24 hours without the aid of fever reducing medication? What's the recommendation for healthcare workers returning to work?
So healthcare workers can return to work using a properly fitted N95 mask when they're starting to feel better. Really hard to do, I think, to wear an N95 mask all day. So there are a number of healthcare workers who are just staying out those extra 5 days.
Great. Well, we've got lots of thank you comments, and this was
Okay, good.
um, and I think we've got a couple of suggestions for future topics. So I think that's great. I'll give one last call for anybody who wants to add a question into the chat or into the Q&A. And again, we did record this, and so we're going to be putting it on our Douglas Public Health Network YouTube page and also our webpage. And we also have a couple of upcoming webinars that are happening. We've got one in October, which is going to be part of our As Medicine series. That's going to be Purpose as Medicine with Richard Leader. And that's happening on October 15th. That's on our website, and the registration for that is on our DPHN website as well. And then we've also are going to have Erin Fredericks back for Food as Medicine Part 3. And she's going to talk about holidays again and helping our metabolism and health during big holiday meals and traditions. So please join us. That'll be on November 12th. So again, that's on our website as well. Not seeing any other questions, but a lot. So thank you. So thank you all for your attention and your great questions. And as I mentioned, please look to our website and to our YouTube channel for this. And a big thank you to Dr. Bob. This was great. Thank you so much.
Thank you. All right. Thank you so much.
Hey, everyone.